A major shortage of the dye used in CT scans, MRIs, and angiograms may directly impact you as a transplant patient. Stay tuned.
Hit the subscribe button and the bell notification to become part of the Transplant Helper community.
Hey folks, welcome back to the Transplant Helper again today. My name is Jim Merle. I had a phone call the other day I wasn't expecting. I picked up the phone. It was my coordinator from UAB Hospital, Miss Connie. I had been trying to reschedule an angiogram/heart catheterization I had planned for June, and I was hoping she was calling to give me information on that. Well, in a way, she was, but what she actually said was, Mr. Merle, I'm apologizing for having to call you about this, but we're going to have to reschedule or cancel your heart catheterization for next month because she said there is, quote, a major shortage of the contrast dye needed in order to make that effective. Now, she went on and gave me a few more details, but basically I kind of stood back and thought, wow, how is this going to impact me? Is this really going to make a difference? Is this not a test that I look forward to every year so I can get good results and clear images to know what's really going on? Yeah, for me it is. But as soon as I hung up the phone from her, kind of being a little bit worried or concerned, I did what any good person would do. I turned to my computer right here. I began to work into Google and began to find out a little bit about this supposed shortage that's going on with this contrast dye. Here's basically what I have found so far. Hospitals across the country are being forced to ration medical scans and procedures after a lockdown in Shanghai hit a plant that produces a widely used contrast dye, dioxin. The dye, made by General Electric, is used in a variety of purposes, many of which of them are life-saving. Typically, this dye is injected in the patient's veins, and it provides a higher contrast than imaging procedures, say, for example, CT scans or MRIs that don't contain the dye. Among other things, the increased contrast helps doctors to more easily diagnose things like brain bleeds, blood clots, or maybe even see how other organs are functioning to determine whether or not tumors are growing or shrinking in cancer patients. Because of the shortages, hospital systems from around the country have had to defer, quote, non-urgent medical procedures, I guess that's what I was having, and using alternative imaging and diagnostic tools that do not require the dye whenever appropriate. Dr. Matthew Davenport, the vice chair of the American College of Radiology, said, quote, it is very difficult to know what harms are going to occur from this either delayed diagnosis or possibly a misdiagnosis. He added that I am confident there will be some delayed diagnosis or misdiagnoses because we're using imaging techniques that are not optimized and not perfect. Dr. Davenport even went on to say, quote, an estimated 50 million scans per year are done and performed in the U.S. alone based on this dye itself. Unfortunately, we don't have an option to give everybody the contrast dye like we used to, so a bit of it is going to be the best of a bad option. He even posed a personal question to himself, I guess, when he asked, would I rather have no imaging at all or an imaging technique that is not optimal? For me, I'm not sure. Around 50% of U.S. hospitals and imaging centers likely use GE's product, according to Nancy Foster, the Vice President of Quality and Patient Safety in the American Hospital Association. She then added, however, though there's not an exact proportion that can be pinned down to say exactly what that number might be. Most hospitals, for a product like this, would keep on hand maybe a couple of weeks' supply, Foster said, but this shortage has been going on for a couple of weeks now. The shortage is a result of a strict lockdown imposed on Shanghai back on March the 27th as a part of China's, quote, zero COVID strategy. It causes the GE plant there to be shut down for several weeks, though a spokesman for GE Healthcare said in a statement that the plant has begun to reopen and they're, quote, working to return to full capacity as soon as possible. The spokesperson added that GE is accelerating deliveries by shipping by air instead of by boat from both its Shanghai plant as well as its plant in Cork, Ireland, to address the U.S. supply issues. But even so, the health systems do not anticipate immediate relief. The shortage could last into the summer, forcing medical providers to continue to postpone or lower priority of imaging situations as they ration their stockpiles. So, knowing some of this, I have a few questions for you. Number one, what do you think about this? Is this going to affect you or has it affected you already? For me personally, I'm going to tell you up front, I actually look forward each year to my heart catheterizations and angiograms, as I've come to know that even though they're a little more risky, a little bit more dangerous, they give absolutely the best perspective and view on what's really going on in my body. And given the fact that I had my aortic valve replaced about 3 years ago, and it was said to last about 8 years, I kind of like to keep a check on that. So I'm not looking forward to a year without this. And actually what I'm hoping is maybe toward the end of the summer, if some of these shortages begin to kind of improve and maybe go away, that I can maybe go back and reschedule that. So my question is, what do you think about this? Does it concern you? Does it worry you? And what do you think should or could be done in this situation? In my opinion, we're just right back in the same boat we've been in too many times in the last 2 to 3 years, and that is we get so many of our things imported from other countries around the world, places like China, in this case most recently like Russia and other places, that we're just having a difficult time. I long for the day when we in the U.S. could really go about to produce more of our own stuff, and therefore we would not have to meet with nearly as many shortages as we have right now. But in the case of this, what can we really do other than wait it out and hope for the best? I certainly would encourage you to be praying for those that are at much more risk than I am. Those people who are going in like they gave in the example back in the stories that I quoted and read from, and that is that we really need to be concerned about those who are going in for the emergency procedures where a diagnosis is needed immediately, and an accurate diagnosis can only be found by using these types of dyes in conjunction with CT scans, MRIs, angiograms, and that sort of thing. Nonetheless, be shouting out in the comment. Let me know what you think about this. Has it affected you already? Do you think it will? Is it concerning? And what do you think we should do about it? Maybe we need to band together and make a solution for this before it goes on for too long. Thank you for joining me today. Until next time, stay stronger, friends.